Well, this is a sectoral ultrasound of a 63 years old male. Gives the history of surgical intervention for umbilical hernia. कितने महीने हो गए?
Sir, 2-3 months.
2-3 months back, and what we see is that this is the right hemiscrotum, in which you are seeing that this is the testis, right testis, and there is a fluid pocket collection seen at the lateral margin, anterolateral margin, with internal echoes and tiny septums within it. This is the epididymis, and this is a tiny calcification within it. The fluid collection measures as a cyst, appearing as a cystic area, measures 23 into 15 mm. There is small amount of fluid seen in the right hemiscrotum. This is the fluid, this is the wall of the right hemiscrotum. And here what you are seeing is the epididymis with calcification in it. This one. This is the head of the epididymis. This one. This is curved area. This is the calcification. Now as I move the probe towards the inguinal region, not in the inguinal region, but just adjacent to the testis, what I see is an extra-testicular, adjacent to the right testis, and extra-testicular mixed echo fluid pocket with posterior wall acoustic enhancement measuring approximately 5.2 into 3.4 centimeters, and this is the longitudinal section of this fluid pocket adjacent to the right testis is extra-testicular. This is a strong back wall you are seeing, and this is the all, this is debris within this so once again, fluid in the right hemiscrotum, the testes, and then a cystic area within the lateral margin of the testes, and adjacent to the testes is seen well demarcated fluid-filled pocket with internal echoes, septas, and debris, mixed echo debris. And now, as I move the probe towards the inguinal region, I see a track formation, extension of this fluid-filled pocket in the inguinal region. Patient is very tender to this region, and why not? It's all infected material. Now this is the track, which is this is the track. This is the inguinal region, the track that measures approximately 47 mm in length and 13 mm in anterior posterior width or anterior posterior diameter. This is the extra testicular fluid collection. Mixed echo, well demarcated fluid pocket, and here comes the right testis. This is the right testis, and it's adjacent to it. So right testis, extra testicular, adjacent to the testis, a fluid-filled pocket collection, making a track in the inguinal region. So what about the left testis? Now this is the left testis, and the subrotal wall is significantly thick. This is the left testis in longitudinal section. See the edema of the wall. This is all wall edema, and you see this is the wall of the testis in general, the measures approximately, it is thick up to 40 mm, giving the appearance of elephantiasis testis, but it's not elephantiasis testis. This is the left testis in longitudinal section, the head of the epididymis. This is the right testis in transverse section, the cystic area that was seen within it, and see the appearance of the wall. Now, unfortunately, this person was operated 2-3 months back. Let's see what is the how much is the fluid material, is the volume of this cystic thick wall, rather cystic area. It's about 40 cc or 40 ml, and this is the wall, and see the thickness of the wall. When I go further upwards, I see that the urinary bladder is normal. This is the urinary bladder, but there is ascites. You see, this is the ascitic fluid. This is the urinary bladder in longitudinal section. This is the fluid. These are the bowels floating in the ascitic fluid. That raised the question why it is so. So when I went up, I saw that, oh, he is a cirrhotic patient. So a cirrhotic patient has been operated upon for inguinal hernia on the right side. This is the fluid surrounding the liver, this is the liver, this is the gallbladder, this is the portal vein, measuring from inner to inner 16 mm. Now more than 14 or more than 13, sorry, is considered to be dilated. So portal vein is dilated but patent. What is the status of the spleen? This is the splenic vein. This is also spleen. Spleen measures approximately 14.4 mm up to 10 mm is considered normal. So the spleen is alive, and the splenic vein is dilated. What is the measurement of the spleen? Spleen measures from pole to pole 19.4 centimeters up to 12 is normal. Now see, this is significantly enlarged spleen from pole to pole. 19.4, 12 is normal. So splenomegaly, we saw, yes, it is the portal vein is dilated, and portal vein is though dilated but patent. Ideally, it should be taken at the level of the portal hepatis, and at the level of portal hepatis, splenic vein is again 16.4 mm is dilated patent. So this is a case of cirrhotic liver with dilated portal vein and its tributaries, shrunken liver, and surrounded by ascitic fluid, dilated splenic and splenic vein as well as the portal vein, and portal hypertension that we label as, this is the pancreas. No para-aortic gland adenopathy is seen. This is the aorta. This is the spermomesenteric artery arising from it. And as you come down, you see ascites. And as we go towards the right inguinal region, this is the crack formation. This one in the inguinal region, you see only 14.5 mm deep to the skin in the inguinal region. When I come further down, I see a fluid pocket, thick walled fluid pocket with internal septas and lot of debris, thick sludge, and this is the right testis showing us, this is the part of the right testis, this is the cystic area that is in connection with this extratesticular cystic mass, and there is small amount of fluids in the right hemispherotum. This is the fluid that we have seen is in the right hemiscrotum. This is the epididymis, head of the epididymis, and this is the epididymis. This is the calcification we saw in it. Now, another thing to note in this patient is that there is mass effect from all these issues on the right ureter that is obvious when we study the right kidney. Where is the right kidney? So this is the right kidney. And you will see the right kidney shows dilation of all the calyces is normal in dimension, and there is marked the raised, the parenchymal echogenicity is raised, no calcification is seen within it. This is the right kidney that you are viewing. This is the right kidney. So, this is another finding in this patient, and that is obstructive uropathy. This is the kidney, right. Though proximal ureter does not appear to be dilated, this is the proximal ureter. However, the echogenicity of the parenchyma is seen in raised corticomedullary differentiation in this kidney is lost. Thank you very much. This is the case of our day.